So I've been doing the updates, and now I'm trying to do a weekly update on what's new in the news, especially around coronavirus. I started this a few weeks ago, just trying to answer questions that I get asked quite a bit in my office. So for my friends and family on Facebook and YouTube, trying to give some answers. So in coronavirus world, right now there's been speculation and questioning about the two companies, Novavax and Moderna, that have vaccines for coronavirus. And at this point, it's only speculation. The premise behind these vaccines is solid. They're similar to other vaccines and they could be effective. The thing is, we don't know yet. How do you judge a product that hasn't been fully tested and fully marketed? We'll find out when they're done with all their testing, and I can give some advice on how effective and how safe the vaccine is. Until then, it is truly speculation, but it still looks promising. Where is the pandemic going? People wonder, now that we're loosening up our restrictions, is there going to be another surge in illnesses? Well, my point would be, when in American history have we ever walked around with hand sanitizers in our pockets and masks for our face anytime we go out in public and stayed distant from people for the most part? My point is that the precautions that we're taking right now as we're moving about in society are pretty big. They're different than things that we've ever done before. I think it will keep the number of viruses down to a small number. I don't think it's going to go away. I hope over the summer that the number of infections slowly dwindles. There'll be little ups and downs, but I think it will slowly dwindle. I don't think it'll go away until the community has more immunity. And that's going to happen through a long process of illness over years, or it could be a shorter process of 1 to 2 years if we have a vaccine by next year. And then that would decrease the illness. So I wanted to talk about something else that's prevalent at this time of year, and that's why I'm outside, and that's Lyme disease. So I get calls all the time of, I got a tick bite, what do I do? So I'm going to start right there. What do? Pull the tick off. Use your fingers or a tweezer, gently get to the base of it, and gently tease it out. Now, don't put hot oil on it, or wax, or flame, or kerosene. All those things are corrosive and can hurt your skin, and they don't do anything. You just need to gently pull the tick out. Now, what if you leave part of it in your skin? It's not the worst thing if you left a little bit of the tick in your skin. If you do that, just gently scrub it with soap and water and a washcloth a couple times every day and try to cleanse that area. Watch it closely. If you see signs of infection, see your doctor right away. Next question is, do I have Lyme disease? Well, if you've got a tick bite, it doesn't mean you're going to have Lyme disease. In fact, what is the odds of you getting Lyme disease from one known tick bite? And the answer is, if it's been attached for 36 hours, the odds are 1 to 3%. Now, it's different studies and different looks at it, but 1 to 3%. I'm just going to say 3% just for simplicity. So one tick bite's been on for 36 hours. Why do I say 36 hours? Because that's the way that the bacteria, the B. burgdorferi, is transmitted from the gut of the nymph tick. So it's in the gut of the tick. The tick has to attach to your skin, take a blood meal, fill the gut with the blood, and then the bacteria is transmitted back to the mouth parts. So that's a process. It's not just sitting there waiting in the mouth parts to be injected into your skin. It's inside the gut and it's inside the tick, and it takes time to transmit that bacteria into your skin. All right, so it does take about 36 hours. If you've gotten the tick off before 36 hours, the chance is very, very small that you're going to get Lyme, and you should just watch for symptoms and be aware, but you don't need to do anything. We do prescribe Doxycycline to people over the age of 8 years old and not pregnant as a preventative for high-risk bites, which are over 36 hours or embedded into your skin or engorged. And that decreases the risk of Lyme by about 87% in one study by the New England Journal of Medicine. And if it's less than 36 hours, the recommendation is that you don't need anything, just be aware. Now, people will say, but people don't even know they got a tick bite and they get Lyme. You're exactly right. The nymph stage is the most common one at this time of year, and it's very small, and it's hard to see. So most people don't even know, not most, at least half, don't know that they got bit by a tick and they get Lyme disease. So one of the take-home messages today is, at this time of year, you should know the symptoms and just be aware of them. If you get a fever, headache, rash, aches, and pains at this time of year and you don't have a good reason for it, you need to be evaluated. You need to be talked to your doctor. So Most everybody with Lyme has some of those symptoms. It's not the sneakiest disease in the world. I know people have that perception, and that's probably because they get too many blood tests done and are incorrectly diagnosed by a blood test. The symptoms of Lyme are not real sneaky. Be aware of them, watch for them: fever, headache, aches, pains, and the rash. If you have any of those, you don't have to have them all. If you have any of them, talk to your doctor. Now, why don't I just order a blood test? I'll have people say, I got bit by a tick. Just test me and find out if I got it. All right. You have to understand the nature of tests and where you are at that point. So there's a couple things that go into every test. Its sensitivity and its specificity, which tells you about how often is it truly positive, truly negative, false positive and false negatives. The pretest probability is very, very important when you look at a test. So I use the percentage 3%. So if you have a high risk bite, 36 hours, your odds of having Lyme is 1 to 3%. That's your pre-test probability. So if I take everybody in that group and I test them and I do the calculations for likelihood ratios and come up with a post-test probability with a 3% pre-test probability, the effectiveness of that test, the post-test probability, is only around 20%. What that means is if I test you after a tick bite, even if it's a high-risk tick bite, and I get a positive Lyme titer, it's going to be right about 20% of the time. That test doesn't get me any closer to my answer. It doesn't help. It's not worth doing. In all of medicine, we know that tests have their limitations, and we know when to use it and when not to use it. That's not a good time to use a test. When do we use it? Well, we look at symptoms, because when you have Lyme disease, there's always symptoms, and you need to talk to us about your symptoms. If the symptoms are there, the post-test probability goes way up. Even if there's just minor symptoms and I'm not sure if you have Lyme or not, or maybe I'm 50-50, if I use a 50% pre-test probability, the post-test probability goes up to 89% for that test. So it's much better to use in that case. And the way we like to always teach in medicine is tests do not answer your questions. Tests help confirm our clinical suspicion. Tests help us when there might be some question. So those are some of the answers. It's some of the reasons why I do what I do, and your doctor may do what she does. So I hope you're safe this summer in the outdoors, and always check yourself for ticks after you go out. I've got to go out inside and make sure that I don't have any ticks on me.